This conference.
The very rare chances we would usually get to treat them medicinally. There are rarest of rare cases when what we can say, the patient says that no, I am ready to take this for 1 month or 15 days. When the prolapse patient comes, he or she always insists of to get done operated. Next slide, please. Okay, so just to understand, Shushka Parisravi, that is which Shushka is Vata Kapha in origin, and Parisravi is Pitta Rakta in origin. So when you want to compare both of them with the modern types of hemorrhoids, we can say also, I mean, Vagbhat also mentioned the Bahya and Abhyantar Arsha. So these are typically similar to external and internal hemorrhoid. Okay, so Ashtanga Sangraha also mentioned one type, that is Drushya Adrushya. Again, that. So, what we can say, local examination is very, very important. Whether it's Drushya or Adrushya, you have to assess it locally. Sahaj Janmotar. This is also one type of though it has no clinical significance, but I have seen the patient which is what we can say of age 4 years, which has hemorrhoids. That I mean proctoscopy, we have sent the patient to what we can say digital proctoscopy with the smallest proctoscope. But I have seen a cases over in which age of 4 years also has hemorrhoids. Okay, so Shushka, that is Vata Kapha oriented, as I said, that you rarely seen bleeding in external hemorrhoids, and Parisravi, that are internal hemorrhoids, where you practically see the bleeding. Okay, these terminologies will help us to what we can say select the Aushadhi Kalpana for the treatment. Okay, next slide, please. Okay, so just to understand, I have put some pictures that internal hemorrhoid. This is a venous plexus. You can see in both pictures that is the internal hemorrhoid and external hemorrhoid. Next slide, please. There would be one more picture to understand the anatomy of anal canal. Next slide, please. Okay, so this is a TS section, pathological, what you can say, histopathological section, where actually what pathology happens. You can see these pits. These pits are nothing but the marked dilatation of hemorrhoidal venous plexus. These are veins actually, and these this is the dilatation of vein and fragmented anal subepithelial tissue. You can see where I have put the hash is there over there. So the fragmented anal subepithelial muscle is like that. So this is a diseased, removed, what we can say, hemorrhoid or a pile mass which has removed, and the pathological section of that mass has done. So you can see what kind of pathology has happened. So this is a nothing but the dilatation of hemorrhoidal venous plexus. Next, please. Okay, just to be sure, when you examine locally, what I mean, we'll just compare all the 4 degrees and we shall move forward. So, bleeding and no prolapse, that is the first degree, and I have it has just mentioned what can be done in case of these hemorrhoids. So advice a stool softener. These things are advice according to a modern science. Okay, so dietary modifications, stool softener, increase fiber and water intake. So another misconception of there is an what we can say, I have mentioned in next slide, that many proctologists, modern proctologists, we can say, they ask you to drink lot of water to make a clear passage of stool, which is actually what we can say contradictory to our science. We shall discuss it later. We'll just see these things very quickly to move to main topic of our subject. So second degree, so bleeding with prolapse, spontaneous reduction, dietary modification. So in second degree, you can do a OPD procedure called as rubber band ligation, coagulation therapy, etc. Then the third degree, Okay, the bleeding and prolapse requiring manual reduction. The patient comes to you and complain kahitari bahir. I hope you're no Hindi is the thing. Okay, so something is coming out and it goes inside when the defecation done. Okay, the patient कहता है कि नहीं इस मोशन को जाके आने के बाद जो मांस आता है वो अपने आप अंदर चला जाता है. So when the patient comes to you on come to you with this complaint, this must be a second degree hemorrhoid. This happens to a second degree hemorrhoid. When the third degree hemorrhoid is there, it is usually happens to be the pile mass come out, but the patient has to reduce it manually. Okay, it stays over there and the patient reduce it manually, and the fourth degree hemorrhoid is prolapse, unreducible and strangulated. So the complication happens to this stage where fourth degree hemorrhoids are to be happen. Next slide please. Okay, so here's another picture of first degree, second degree, third degree and fourth degree. Next please. I hope you understand what's the idea behind it. So okay, now what's the clinical picture? That is bleeding, fresh bright red mucus discharge, prolapse, pruritus, anal pain. Anal pain, as I said, that anal pain is not the common what we can say clinical picture of hemorrhoid. Hemorrhoid is usually a painless entity when only the hemorrhoidal mass prolapse out of anal verge, only the pain arises due to complication. And what we are dealing today, we are dealing with first and second degree hemorrhoid. There are many cases who have treated with third degree hemorrhoid also with medicinal treatment, but the patience is the key behind these all kind of treatment. Next slide please. Okay, so again over here we need to understand what Ayurveda has to say about Samanya Lakshan, what is common symptoms of hemorrhoids. So hemorrhoids has Baddha Pakva Purishatvam Saraktam Va Krushatmana Guda Nishpedanam Kandu Toda Cha Arshamsi Lakshayat. So very commonly you can find all these symptoms to any kind of hemorrhoid patient. Baddha Pakva Purishatvam, that is what we can say a constipated person with sarakta krushatmana, the what we can say motion are with bleeding, I mean bleeding piles or bleeding motions are there, and the patient is usually happen to be krusha due to what we can say loss of rakta or what we can say bleeding. All we can see in a pruritus, that is kandu toda, all the symptoms we can able to assess in a patient because patient itself saying. There are chances when rarely accidentally the patient do not understand whether there is no PR bleeding, no any patient come to you for a different what we can say different kind of complaint, and when you accidentally find when you do a proctoscopy and the patient has hemorrhoids. But in case of first and second degree, which are usually undiagnosed in certain cases. Okay, but the only thing I need to mention that the patient comes to you only when it is unbearable. Otherwise, patient यूजुअली टेक्स ओटीसी मेडिसिन. इसने बताया है, दादी का नुस्खा है, ये हुआ, इसने बताया था, उसको फर्क पड़ा, उस वजह से मैंने ये लिया, और आइदर कहीं पे सुना था सूरण की भाजी खाओ तो and stuff like that. I mean, people comes to you when comes to a surgeon or comes to a doctor to show locally when it's unbearable. So these need thing. The one thing we can do is awareness, creating awareness to do not ignore the symptoms. Okay. Next slide. Next slide, please. Anyone change the slide because I'm not able to see the slide. Slide had changed or not?
Not changed yet.
Yes, not changed. Uh, just a second, please hold. I'll just call them back. Yes, the slide has changed. Okay. So when the hemorrhoid is of 4th degree, the complication shall happen is excessive bleeding, strangulation, thrombosis, ulceration, gangrene, fibrosis, suppuration, and pylophlebitis. As I have mentioned this before, that how to assess all these vata pitta kapha condition, you can only assess when the complication occurs. Okay, excessive bleeding will lead to the coloration, discoloration of that particular pile mass will lead to a pittaj kind of pittaj variety of pile mass. Okay, the strangulation will also lead to pittaj because the bluish discoloration will easily accessible to do. But as I have said, the patient comes to you with all these what we can say for him or her a horrifying condition like excess what we can say the prolapsing pile mass. They come to you for getting operated only. Okay, so there are rarely getting chances of treating on a medicinal treatment to this patient, but usually it depends on what condition in what condition patient comes to you to get operated or to get medicinal treatment. Okay, so these are the condition where thrombosis, ulceration is also comes under what we can say pittas kind of prolapse hemorrhoid. Gangrene is also under pittas. Fibrosis, you can see a whitish fibrosis of healing wound which comes to a Kaphaj type of variant. Suppuration, that is discharging pus from the infected what we can say pile mass. This also comes under a category of Kaphaj kind of pile mass, and pylophlebitis. Next slide, please. Okay, so before going for so how to differentiate patient for surgical treatment and for medicinal treatment. So take a good clinical history, physical examination, visualize with anoscope. As I have said, the thumb rule of local examination. Okay, that is PR and anoscope. Okay, so next slide, please. Clinical history is really important if you are going for a ayurvedic treatment or going for a subtle what we can say examination of the patient. It is always mandatory to take proper history of the patient, because all what we can say key factors you can find in a diet and everything. We shall discuss it later, because all the lifestyle what we can say I wouldn't say sedentary, but all the lifestyle and eating habits are responsible to develop these conditions to get worsen. Okay, so what kind of treatment a vaidya or a doctor or a proctologist, anyone who can offer at his point of view, that is medical therapy, minimally invasive techniques, surgical therapy. Next slide, please. So for the grade 1, grade 2, grade 3, grade 4 and complicated, any kind of what we can say, any kind of hemorrhoid, dietary and lifestyle modification is the topmost advice given should be given by a doctor. Okay, this is based on the modern science. Hence, it has mentioned that high fiber diet, laxative, hydration, avoidance of straining. But the key behind all these, with all these in the Ayurvedic system, is little bit different that we shall going to see soon. Okay, medication is responsible for topical and systemic. Now we can say office based procedure, that is rubber band ligation, sclerotherapy, the sclerosant like ascarol used in a day to day procedure. These are also good techniques when first and second degree hemorrhoid are not responding to medicinal treatment, or a patient itself comes to you that I want to do that particular type of treatment. Okay, other thing is non-excisional operation, which are very popular these days for third and fourth grade, from second to fourth grade to complicated hemorrhoids. These are like Doppler guided hemorrhoidal artery ligation, that is DGHAL, and SHPPH, which is very common amongst all my what we can say modern proctologists. So patient insist themselves to go for a stapler, even though it is a grade second. They go and insist the surgeon to go for a SH and PPH, that is a procedure for prolapse hemorrhoids, okay, which is also called as stapler hemorrhoidectomy. This is very popular amongst fellow surgeons. All I have seen that even though second degree, third degree, fourth degree people are get operated due to mild to moderate complaints. So we can say that काय म्हणूयात आपण की finding a root cause, removing the root cause will do everything. No, this is not true, because I have seen many cases who have undergone all these things, but still their complaints and their symptoms have not gone. Okay, so as I said that first thing I have mentioned that the dietary lifestyle is applicable to each and every type of hemorrhoid. Okay, and the other one is very common, which we have seen in our what we can say surgical post day, that is excisional operation, and still till time we are doing this. But what we can say, even patient comes to us and say nahi, DGHL is not very common, but SHL, that is stapler hemorrhoidectomy, is very very common these days, and it is very quick surgery, and but we can say 1 day procedure. An excisional operation, which is which we do for what we can say in a institutional level, that is open and close hemorrhoidectomy, which is quite common in institutional level. Okay, next slide please. Okay, so coming to the point now, which is my favorite topic to talk about. So when Sushrut gives us option which are more different than what we can say a modern, I would say that modern science is what we can say the modern surgery is based on Sushruta science. So तत्र अचिर काल जातानि अल्पदोष लिंग उपद्रवानी साध्यानी. What we have said first in the modern science slide, that achira kala jatas, that is newly arised hemorrhoids, those who have alpa dosha, alpa linga, alpa upadrav, these are treated with medicine. Okay, and the other thing are mrudu prasuddha avagada uchritani sharina karkasha sthira prithu kathina agninam tanumula uchritani kledavanticha shastrena. So like Ayurveda, modern also has done the differentiation. So we need to focus on the first first line of that achirakala jatani alpadosha linga upadravani bheshaja sadhyani. Next slide please. So we are dealing with when we can give medicine, how to differentiate. What modern science say? Modern science says that bleeding from first to second degree hemorrhoids often improves with the addition of dietary fiber, stool softener, seeds bath, increased fluid intake, avoid dons of straining, and associated pruritus may often improve with improved hygiene. So this is a quite what we can say a common prescription of any surgeon would advise what can be done to hemorrhoid. Okay, next slide please. Just a moment, I'll just take a break of 1 minute only. Just a second. Okay, sorry for the interruption. So other supportive mentions are this is based on what we can say a modern science. So simple dietary changes such as increasing amount of fiber. Seeds bath is compulsory for any anorectal disease. As the Ayurveda also says that Avagaha Sved is very important. Okay. Uh, Fermentation of local area has been found very useful. The patient is asked to sit over a tub filled with lukewarm water. So the common, what we can say, commonly advised by any anorectal surgeon or uh, any anorectal practitioner can advise all these things to you according based on the modern science. Next slide, please. So minimally invasive technique, we have seen that these are rubber band ligation. Cryosurgery in these days, we don't do cryosurgeries because it's an absolute method. Bipolar infrared or lasers, these are popular under minimally invasive. Usually what I have said, that patient comes to us in a very late stage, that they go on a Google search and identify all these things and come and say us, no, now I am tired of taking medicine, I need to go under surgery or anything minimally invasive you suggest me. That's why I have mentioned these things over here. Next slide, please. Okay. So what are the indication of surgery? So you can differentiate your patient whether it is operable or whether it is for the medicinal treatment. If there are external hemorrhoids, this is based on modern science, hence I have mentioned this, but you can successfully treat external hemorrhoid reducing their size. I have seen the patient reduce. I have mentioned one case of external hemorrhoid which I have seen before and treated the way I have mentioned all these things. But as per modern science says that external hemorrhoids should go undergo operative procedure. The symptomatic hemorrhoids in presence of concomitant anorectal condition that requires surgery. Patient preference after discussion. What I have said before, that patient usually comes to you and say, no, I have to go for a surgery only, with a referring physician and surgeon. Fibrous hemorrhoids, external hemorrhoids, symptomatic hemorrhoid, basically the complicated hemorrhoids. The symptomatic hemorrhoid in presence of concomitant anorectal condition that requires surgery. Patient preference after discussion of the treatment option with a referring physician and surgeon. Next slide, please. Okay. So coming to the today's topic. Okay, what is Aushadhi Chikitsa or medicinal treatment? So most importantly, what my guru have taught me. So I will give you that advice definitely. If you are good in Dosha Dhatu Mala Vidyan and your Nidan is perfect, then your Chikitsa never fails. Wouldn't say fails. You try and we can say, even if you go on a wrong way, you have a chances to rectify all your what we can say dosha dhatu mala nidana, and you can go and assess it properly and give medicine. It will definitely help your patient to improve. Okay, next slide, please. So, Ayurveda Chikitsa and modern allopathy medicine. We'll first see modern allopathy, what modern allopathy advice. So, that would be better to understand what today's age or today's era needs to do. Okay, at what stage? We need to understand what kind of treatment you have to give. If the patient come very early, there are chances of getting treatment, medicinal treatment, and what we can say, getting rid of that disease. If the patient is too chronic and all the surgical advices, it fits in that all surgical advices, then it should go for surgery only. Tired of taking many OTCs. So this is also an interesting topic. How many patient comes to you, come to the, I have taken Niranjan Phal, that is Malva nut. Someone would say, no, I have applied Kailas Jeevan for longer period of time, still I have no any improvement. People usually go to a doctor, they see a prescription where LOX 2% seems to be helpful, and they used to keep on going applying LOX 2% lidocaine for a longer period of time. That's their only treatment, and the Bengali doctors to visit. So I have a very what we can say anecdote to tell you about Niranjan Phal, that is Malwa nut. everyone, I think everyone is aware of Niranjan Fal, right? Yeah, that's really helpful treatment, but getting rid of what we can say all the symptom of hemorrhoids. But how many of know how it has named Niranjan Fal or a Malva nut? Anyone can message me in the chat box. So Niranjan Fal is basically came to us from China. Okay, it's a medicine from Chinese medicine. Malva nut is a medicine from Chinese medicine. So how it named Niranjan Fal, I have heard an anecdote from my what we can say older generation that everyone is aware from Natha Pantha from all over India, where Ganini Nath, Matsya Nath, or other saints, those who are related with what we can say Natha Sampradaya. So these Natha Sampradaya introduce this Malva nut to India. Yes, this story came to me around 4 to 5 years ago, but I don't know how it is true or not. But the Niranjan Fal is named because these they used to call Alakh Niranjan, and all their what we can say worship is done by standing. Okay, what we can say tapascharya or something kind of is Natha Sampradaya's specific what we can say prayers or their type of sorry, is there any sorry, I cannot hear you. Somebody is saying something.
Someone is talking on phone call.
Okay. Shall I continue then?
Yes, please.
I thought somebody is asking question. That's why. Take that the later phase of a lecture. Okay. So the Niranjan Far will get it quickly done. Okay. So the Niranjan Far is said that they used to call it Alak Niranjan, and because of their long-standing prayers and prarthanas or tapasya, they used to get hemorrhoids. Okay, and these they are what we can they are wanderers. These saints are wanderers amongst all these regions. They bring that Malva nut to India. In Chinese medicine, it is Chinese medicine also has some base like us Vata Pitta Kapha, which is based on what we can say Rakta Dushti. Okay. So the disease which are based on Rakta preference, the Chinese medicine use Malva nut for the same. Okay. So that was the story behind Malva nut. This story was new to me 4 5 years before, but I don't know this is anecdote or this is true story. But our elder people say that the Niranjan Fal is introduced by Natha Sampradaya to what we can say common peoples for a medication. Next, please. I think I have put a picture of Malva nut. If anyone hasn't seen Malva, what is Malva nut? Okay, just put a just a second. Okay. Now the charging is on. Okay, so this is Malva nut. Niranjan Fal is quite famous and common OTC treatment for the hemorrhoids. Okay, next please. Okay, now we'll go to a modern treatment. Okay, one other thing is also I have to mention that Bengali, what we can say quacks, usually treat just to start this slide before. I have heard that the Bengali people usually what they operate, they show a mutton chops of they store it to them and they show that your hemorrhoid has been cut and now you are got rid of hemorrhoid. So these thing. So the relapses patient usually comes to us. They said that no, the Bengali doctor had operated on me. How could I can get once again the bigger hemorrhoid than this? So these things had happened before. We have seen in OPDs and in some of patients. So what systemic and topical given by modern science, that is Daphlon, the very common drug usually people prescribe for a hemorrhoid, first and second degree hemorrhoid. So this is nothing but an oral flavonoid, which is venotonic agent, where first described the treatment of chronic venous insufficiency and edema. Usually used in all chronic venous insufficiency, including hemorrhoid. Okay, as I said that we have learned about CVA, CVI, chronic venous insufficiency. It is used everywhere. Next, please. Okay. The other very common and very popular medicine, that is Dobicil. The usually surgeons prescribe that. It is another venotonic drug commonly used in diabetic retinopathy and CVI, that is chronic venous, as well as in a treatment of acute symptom of hemorrhoid. So demonstrated by the calcium Dobicil decrease the capillary permeability, inhibited the platelet aggregation, improves blood viscosity. A clinical trial of hemorrhoid treatment showed calcium dobicelate in conjugation with fiber supplement. So this is also, these both treatment also, the research says are under, not that significant. I mean, improvement and inflammation of hemorrhoid is reduced, but very little bit. Okay, even the patient with first and second degree hemorrhoid feels better for a shorter period of time, and then all the symptom arises again. Next, please. So now come to the systemic and topical. What modern science use? So aim to control the symptom rather than cure the disease. Okay, these topical treatments are usually for to control symptom. Other therapeutic treatment could subsequently require. OTC cream, suppositories are, everyone must be aware of that. Local anesthetic, corticosteroid, antibiotic, anti-inflammatory. The local anesthesia LOX 2% is very popular. Bucomethanazole is very popular. Antibiotic metronidazole cream is very popular for this. Next slide, please. So nifedipine is one of more common, and anovate. Anovate is very, very commonly prescribed by general practitioners without examining patient whether it is fissure or hemorrhoid, but over the counter people take anovate for a local application. So the topical nifedipine on sequence to relaxation and effect of internal anal sphincter rather than hemorrhoid tissue. And phenylephrine, that is anovate. Anovate is nothing but phenylephrine. Is a vasoconstriction having preferential vasopressor effect on the arterial site of circulation. So those patients who long-termly uses nifedipine have what we can say consequence or a secondary to it, that is headache, because of calcium channel blockers are responsible for dilatation of vein, and that pressure comes down and headache starts. So there are so many patients who use Lox Heal or something like that. They usually, if the long standing use of all these local application have done, they ultimately have their consequences. Okay, so instead of that, we usually use, instead of Lox and nifedipine and anovate, we usually use other methods, that is alternatively, that we don't prescribe at what we can say Tarashan hospital. We usually prescribe Lox 2%. We always prescribe them Shatadauta Gruta to apply locally. Next, please. And it has similar effect, rather better effect than these local applications. Okay. So finally, we have come to an what we can say the main topic, that is Chikitsa Sutra. So what can be done in a Arsha? So first, to keep in mind, I would definitely ask you to remember these Vagbhatas, what we can say, not shlok, this is a mantra of treating hemorrhoid. Okay. So Chikitsa Sutra, which is mentioned in Arsha Chikitsa, that is last line of Arsha Chikitsa, that is Arshotisara Grahani Vikara प्रायेण च अन्योन निदान भूता सन्ने अनले संती न संती दीप्ते रक्षेस तस्तेषु विशेषतो अग्नि. So best thing to do is rakshet agni. Okay, treat agni mandya first, and then go for hemorrhoidal treatment. I shall show you what kind of diet, what kind of thing you can advise to your patient. Next slide, please. So when Vagbhata divided the treatment, it is divided into Bhinna Shakrut, where Grahi treatment is advisable, and Gadha Shakrut, that is where Mala Anuloman is required. Okay, so we rarely see the Bhinna Shakrut one patient where what we can say, Bhinna Shakrut one patient where usually the patient, what we can say, have prior history of IBS or IBDs or anything related to Crohn's. Okay, these secondary and hemorrhoids are eligible for this type of treatment, where Grahi treatments are advisable, where Shunthi, Dravya like Shunthi or Dravya like Musta are really helpful. Even though on the basis when IBS or IBD patient comes to us, the first choice of drug comes to our mind is always and always Musta Shunthi should be added in the pudi. Okay, pudi is fine with you, all of you. You are aware of the concept of pudi. Okay, so the what we can say, the churna preparation we give is always there should be a Shunthi and Musta. Okay, when you see a patients of IBS and their secondary, into that secondary, a patient has developed develop a hemorrhoid or something like that. Okay, you face usually what kind of patient? That is Gadha Shakrut patient, where the patient usually constipated, or what we can say, we have a term which is not exactly constipation, but when we write in our institute, that is asamadhan karaka mala pravrutti. Okay, so that might be come under a mucus kind of or anything like that, but asamadhan karak, incomplete evacuation, which is also related to what we can say IBS and all these things. But usually you face a patient which comes to you from in form of hemorrhoid is usually constipated. That's why because of constipation, because of trauma to wall, the patient get PR bleeding and patient comes to you to get treated his hemorrhoids. Okay, next slide please. So Samprapti, you need to understand whether Shushka or Bahya. First, you have to assess the dosha whether it is Vata or Kapha, and for Raktasha, you have to always treat like Rakta and Pitta. When a Raktasha or Abhyantarasha comes to you in a milder form, always think of a Nakkeshar. The more and more common drug we use for a PR bleeding is Nakkeshar. Nakkeshar absolutely given to the patient in 7 days. We have seen that Nakkeshar with butter, freshly churned butter, that is called Loni. If they are what we in the Hindi talking people, for them makhan is the thing. 1 spoon of makhan and 250 milligrams of Nakkeshar churna, and it should be consumed with khadi sakhar. Khadi sakhar, that means rock sugar. Okay, so this preparation works best for the PR bleeding, and we have seen patient get relief within 5 days for acute PR bleeding with this single most medicine. Okay, yes, single medicine is also work wonderfully if you diagnose properly. Okay, Shushka is Vata Kapha originated, and Raktarsha, that is Abhyantararsha, that is Rakta Pitta originated. Next please, next slide. Okay, we'll just discuss one case that will open so many channels to for the discussion, where different kind of cases and these things happen. How these are some slide of where I teach overseas in a US college. So this is same case I have put forward to you to understand how even though external hemorrhoids can be treated with based on a principle, but how to think about it. I mean, when you take a case, how to put forward and how to conclude for a what we can say kalpa which you are going to use. Okay, we'll just see a case. A 43 years female came to an OPD with following symptoms: a non-bleeding pile mass protrusion. As I have said that we have seen that first slide is Vata Kapha's variety or Vata Kapha's variant is of what we can say Bahya Arsha. We have seen that. Okay, is repositioned on their own without manual help since 1 year. Okay, etiological factors, that is chronic constipation, straining during defecation, On examination with proctoscopy, pile mass found 3 and 7 o'clock on the second degree. Okay, so this kind of what we can say, this kind of case is external internal hemorrhoid, which is based on the pile mass which is out, that is non-bleeding, even though the internal pile mass is also not bleeding that much, because the patient is not having any kind of what we can trauma. Even though there is a chronic constipation, patient yet not get any trauma during defecation, if the straining during defecation. Okay, next slide please. So basically the patient has piles, but it has no bleeding, only the pile mass is protruding. Okay, then the diagnosis is second degree internal hemorrhoid. The dosha over there is vata kapha predominant, that is dry shushka hemorrhoid, even though there is no bleeding. And the variant, I mean, if you do a proctology, you can assess that the patient's submucosa is still intact, even though there is something protruding. So what will be the treatment principle? The treatment principle should be vata pacifying treatment, means vata shamana chikitsa, channelizing the excretory system, that is srushtam in mutra, should be a plan of plan of action. So anuloman, as we have seen that vata anuloman is very important in these kind of cases. Medicine and purgative, medicine with purgative property should be used, and a root, vata's root, that is vata anuloman, should be done. So this should be your treatment principle. When you diagnose correctly, you would go for a better choices of treatment. Next slide please. Next slide. Okay. Okay. So, to what we can say, we will differentiate these kind of what we can say, how to differentiate and how to bifurcate all type of treatment. But first you have to, I'm so sorry because these are typed in English, because these slides are copied from my other presentation, which is to be presented at I have presented before this to US students, so hence they don't understand the Ayurvedic terminologies. But I will talk this about, I will represent you this particular table in form of Ayurvedic terminology. So what dosha has increased, कौन सा दोष यहाँ पे बढ़ा हुआ है, तो वात कफ बढ़ा हुआ है. यूनिवर्सल क्वालिटीज मीन्स कौन से गुणों से ये जो है, कौन से गुण, विच गुणास आर विशिएटेड, और जो कौन से गुण है जो दोषयुक्त हुए हैं और कौन से गुण है जो बढ़े हुए हैं, और उसके लिए कौन से एंटागोनिस्टिक, उसके विरुद्ध गुण कौन से, ट्रीटमेंट के लिए कौन से गुण इस्तेमाल करने हैं, और उस के लिए विरुद्ध गुण की कौन से रस उसमें उस प्रॉपर मेडिसिन में होने चाहिए, और कौन सा वीर्य होना चाहिए. ये अगर आपको समझ में आ जाए तो आपको कल्प चूज करने में कोई दिक्कत नहीं होगी. यहाँ पे मैं कल्प सिखाऊंगी नहीं, बस आपको एक आइडिया, प्लान ऑफ आइडिया दूंगी. अगर आप हर बार इस व्हाट वी कैन से, इस ये जो चार्ट है इसे माइंड में रखे कि आपको किस दिशा में जाना है, बिकॉज आयुर्वेदिक ट्रीटमेंट जो होती है वो हर बार सिर्फ औषध पे नहीं होती. अगर बताया है कि कंकायन गुटिका अर्श में इस्तेमाल करनी है, तो आइडिया और थॉट बिहाइंड इट शुड बी व्हाट, क्या थॉट है जो तुम्हें प्रोवोक कर रहा है कि ये कल्प को यूज किया जाए. सो दैट शुड बी कीप इन माइंड. सो इफ द वात दोष इंक्रीज, वात दोष अगर बढ़ा है तो वो रुक्ष और रफ, दैट इज खर गुण से बढ़ा है. ओके, रुक्ष और खर गुण जो है वो तुम्हें उस पाइल मास पे लगेगा. ओके, तो उसके विरुद्ध गुण जो है उसमें क्या तुम्हें यूज करना है, तो उसमें लघु, जिसमें लघु और जो खर, सॉरी श्लक्ष्ण और ये मतलब आई एम सो सॉरी बिकॉज ट्रांसलेटिंग दीज थिंग्स आर रियली सो व्हाट वी कैन से टीडियस. ओके, जो है श्लक्ष्ण गुण वाला मेडिसिन जो है और जो लघु है, और जो हमें रस यूज करने हैं वो जो है मधुर और लवण करने हैं. और जो वीर्य है वो है उष्ण वीर्य का मेडिसिन हमें यूज करना है. कफ के लिए जो है वो स्थिर जो है द स्टैग्नेंसी ऑफ ब्लड इन द वेन्स विच इज रिस्पॉन्सिबल टू स्टे देयर. सो कफ का यहाँ पे जो संप्राप्ति क्या हुई है उसकी वजह से जहाँ पे स्थिर है और डेंस और हेवी गुरु है, और जो मेडिसिन एंटागोनिस्ट प्रॉपर्टी का यूज करना है दैट इज मोबाइल, और जो ये करना है वो एस्ट्रिंजेंट पंजेंट दैट इज कषाय रसात्मक, कटु रसात्मक और तिक्त रसात्मक सारी औषधियां है वो यहाँ पर जरूर आपको हेल्प करेंगी. विल गो. अभी प्रिस्क्रिप्शन में क्या देना है, ये सारे गुण जिस औषधि में है वो मैं आपको बताती हूँ अभी. नेक्स्ट स्लाइड प्लीज. Sorry, are we having some time issues? We need to wind up fast because only 4 to 5 slides are remaining. We'll just, we can say, deliver it quickly and take some questions. Only this case we shall move forward, and then we will take some questions. Okay. Next slide, please. Okay. Okay, so what kind of prescription you will advise to this type of particular patient? So the prescription will be Triphala Gugul 2 BD with warm water, Abhayarishta that is disease specific, व्याधि प्रत्यनिक द्रव्य, व्याधि प्रत्यनिक कल्प जिसको बोलते हैं कि यही व्याधि में देना है, क्योंकि सारे जो लक्षण जो बताए हुए हैं जहाँ वात कफ की वृद्धि है, अभ्यंतर बाह्य अभ्यंतर अर्श की वहां पे ये दिख रही है, तो वी हैव टू यूज अभयारिष्ट. एंड क्षार ऑयल इमर्स विक टू बी इंस्टॉल इन द एनल कैनाल. ये जो पिचू है क्षार तेल का, अभी आप बोलोगे कि क्षार तेल जो है वो दिया हुआ है व्याधि प्रत्यनिक कर्ण पूरण के यहाँ में, मतलब कर्ण के डिसीज में जो क्षार तेल बताया गया है, लेकिन वो अपामार्ग क्षार से बना हुआ ही तेल है. वो वी यूजुअली यूज क्षार तेल इन मेनी काइंड ऑफ anorectal diseases, even though for the healing of fistulous tract, a cut tract and where dressing is required, we usually put a Shar oil over there, a wick of a Shar oil or a pichu of a Shar oil for the healing issues. Okay, so this patient, specifically this patient, we have seen the size of right now I don't have any put forward any photograph because of what we can say a copyright issue of our research paper. Okay, but the Kshar Tel has made best out of it, or the local application of Kshar oil immer क्षार तेल जो है जिसने इंटरनल और एक्सटर्नल हेमोरॉइड की दोनों की साइज क्या मतलब ट्रिमेंडसली कम की है. सो क्षार तेल कैन बी यूज एज अ एनल पैक, बट प्लीज मेक श्योर दैट द पेशेंट within 2 days, if the patient complains of excessive itching and excessive pitta aggravating symptoms, then stop using Kshara tel. Okay. Okay, there is one question. In second degree hemorrhoid sclerotherapy is best, Pratisarniya Kshar application would be better. Pratisarniya Kshar we usually don't recommend because of wound issues. When Pratisarniya Kshar is applied, a wound is created and there is several mucus discharge. The patient usually do not cooperate with these kind of treatment. Sclerotherapy is best. I think one of my junior from Poddar had done a research for his thesis with the what we can say sclerosant like askerol in a control group, and ksharodak was there as a sclerosant agent, and that was a success. I think in my opinion at that time I have my post graduation were completed, but the thesis was successful, and he did so many patients on that ksharodak. Okay, so Sharodak, so many people use, I guess you can ask Poddar premises whether they are still using the Sharodak for the as a sclerosant. But it is used. In my practice, I don't use Sharodak for Sharatel, I think is a best choice for me for applying. Okay, shall we move next slide? Okay, So many of you might have not known, but I have heard from where I have learned from my gurus, and I think this is one reference in a Rasa Tarangini. I don't know Rasa Tarangini or not, but I have don't remember whether the reference is when the Trifala Gugur has different kind of, when for the lower extremities you can give Trifala Gugur before food. For the disease of abdomen you can give Tripura Gugur in between meals, and after meals the disease of head and neck you can give. So Tripura Gugur has many different kind of Aushadha Kala, and it what we can say act magically, because all our patient when comes to OPD there one common drug to all fissure piles, fissure fistula is always Tripura Gugur, and it works magically. Patient literally comes to you that my symptoms are reduced. Okay, so Tripura Gugur is the first choice of medicine in my practice. I don't know whether there are still different drug, but you can say a Vaidya's favorite drug or a surgeon's favorite drug, anything. But this is one of my favorite drugs for all the anorectal complaints. Next, please. So as our first table says, we'll just what we can say operate Trifala Gur. How Agni Karma is advised in a Sushru 12 for Arsha. What experience do you have about it, ma'am? I'll go to it, definitely. I'll suggest you what can be done. Just a moment, give me some moment. We'll just have a look on this table. As I have said that we are dealing with medicinal treatment because the astringent bitter taste, that is kashaya and tikta ras is there. Thermal energy, that is equally hot and equally, that is समशीतोष्ण कल्प है त्रिफला गुगुल, और उसका जो वीर्य है वो सॉरी वीर्य ही है वो ये है और पोस्ट डाइजेस्टिव दैट इज विपाक जो है वो मधुर विपाकी है और वीर्य समशीतोष्ण है, और जो उसकी यूनिवर्सल क्वालिटीज जो है वो उष्ण, रुक्ष, subtle and clear, that is I have what we can say clear, that is विशद पिछिल जो है जोड़ी इसकी यूनिवर्सल क्वालिटीज की वो है, और उसके गुणों में जो बताया गया है कि वो कफ का रिडक्शन करता है, और स्वेलिंग दैट इज शोथहर जो बताया गया है, उस वजह से ये डिसीज स्पेसिफिक होता है और काफी अच्छा उसमें जो गुगुड़ है वो भी काफी अच्छी तरह से काम करता है और कफ और वात दोनों पे काम करने वाला है। अभयारिष्ट जो है वो अम्ल और कषाय रसात्मक है, जो उष्ण भी है और विपाक में जो कटु है, और उष्ण और रुक्ष मतलब रुक्षता पैदा करने वाला और स्थिर ऐसे है। सॉरी सूक्ष्म है, सूक्ष्म सटल इज अ सूक्ष्म, मतलब सूक्ष्म जो गुण है, जो सूक्ष्म गुण होने की वजह से जो क्या बोलते हैं बारीक कोशिकाएं होती है वहां जाने में जो मदद करता है वो सूक्ष्म गुण होता है, इस वजह से और आप मतलब आपको सबको ही पता है कि okay, what time you recommend for Trifala Gur before after meal? The first slide it has say that lower abdomen is after meal. Okay, so better time to take Trifala Gur after meal. Okay, for Apana Kala it is best to take before food, but these what we can say Trifala Gur, I have put forward the slide, we can move forward the slide afterwards to answer your question. Okay. And the other thing is best medicine for purgation acts without excess loss of water from gut. Abhayarishta is a choice for what we can say laxative medicine which shall be used in this particular condition because अभयारिष्ट तीनों दोष पे काम करने वाला बताया गया है। इससे जो पेरिस्टाल्टिक मूवमेंट है वो प्रॉपर होते हैं, ऐसा एक रिसर्च पेपर मैंने पढ़ा था, इस वजह से मैंने वो इसमें थोड़ा सा मेंशन किया हुआ है। और तीसरा जो है वो क्षार ऑयल, पंजेंट हॉट पंजेंट, दैट इज जो है वो कटु, उष्ण और कटु, विपाक कटु है, और क्षार ऑयल जो है वो तीक्ष्ण स्वरूप का होता है, इस वजह से जो है हिमोरॉइड का साइज जो है वो कम हो जाता है आफ्टर अ पीरियड ऑफ टाइम, बट यू हैव टू वेरी डेलिबरेट इन कीपिंग द पैक और कीपिंग द विक। ओके, जो मैंने अभी आपको पहले बताया था कि क्षार ऑयल एक्चुअली ईएनटी डिसीज में यूज होने वाला है, लेकिन इसके साथ हमारा काम जो है वो काफी दिनों से हम कर रहे हैं और इसके बहुत सारे अच्छे रिजल्ट है, इसलिए हम ये यूजुअली यूज करते हैं। ओके, नेक्स्ट स्लाइड प्लीज, एंड वी शैल गो फॉर द बिकॉज आई हैव सो मेनी क्वेश्चन इन अ चैट बॉक्स, आई थिंक वी हैव डन विद इट। ज्यादा कुछ ये नहीं है. और अदर मेडिसिन जो है वो यूजुअली लिस्ट में है वो गंधर्व इत्यादि कषाय. सो गंधर्व इत्यादि कषाय के लिए एक काफी एक कंडीशन बहुत एप्लीकेबल है कि अग्निमांद्य की हिस्ट्री. पेशेंट बताता है कि खाने पीने में खट्टी डकार, आई मीन if there are so many other GI tract related disturbances which comes to you, patient usually complains more than anorectal complaints. No, मतलब there is anorexia, भूख नहीं लग रही है, and all these things, गंधर्व इत्यादि would be a choice for treatment. क्षीरबिल्वादि I rarely use. षड्धरण चूर्ण should be used with गंधर्व इत्यादि because if the Samprapti starts with the amashay, where the patient itself says ki no, it start with indigestion. I have arochaka, aruchi, all these kind of where the patient tell you that all these symptoms are far more worsening than the hemorrhoid, then you go for a Shadharan Churna. The Shamula Haritaki Leha also used but rarely used. Okay, what laxative? I prefer Gandharva Sthadi Kashaya. Okay, Isabgol husk with a warm. Isabgol husk is specifically, I have a lot to talk about Isabgol husk. Okay, basically Isabgol husk is a natural fiber which creates a bulk, and there are two techniques to take Isabgol. Okay, have you heard of that people take Isabgol for loose motions also, and what we can say constipation also? But taking Isabgol husk in a different forms will give you different result. The people who have what we can say loose motion, they take dry Isabgol and drink water over it. Okay, it will create a bulk. Anything happen? Okay, and when the patient is constipated, you already take a bulk in form of fiber. Okay. So these two different types people take Isabgol, but Isabgol is what we can say well known, well heard, a common what we can say common medicine over the counter, but it's quite I mean, even though these days very modern preparation like what we can say powders given for laxative are mixed with Isabgula husk. Okay, there are so many laxative powder form which modern medicine prefer have Isabgula husk in it. And when it is advised, it is usually the one more question is that whether it is warm or cold water. So I would prefer it shall take with the cold water, because the what we can say load of fiber and dissolving quantity of or a we can absorption of Isabgula husk, and it will swell up, right? So that would have done better in a room temperature water rather than warm or cold water. Okay, next please. So this is the list. You can use any list according to what we can say dosha dhatu mala vidyan. So this is the key. What you have to use, you have to assess the patient, what symptoms he comes to you, or he or she comes to you, then you decide your kalpa. This is just a what we can representative list. We can use several number of drugs what we can in hemorrhoids, even though as I said that one of my fellow colleague is treating hemorrhoid as a vata rakta and using only guduchi, but the patient has really very good results. Okay, if you go with a modern samprapti of CVI and everything. Okay, but there is also other that hemorrhoid is a portal hypertension one, and guduchi is the best medicine for that. Okay, shall we move forward? Any other questions? Next slide, please. So this is a very close to my heart topic, dietary advice, because all what we can say is based on what you eat and what you give to your agni, and how you enhance your agni is really important. Next slide. This is a blank slide. You will see a table for what to eat and what not to eat. We'll just finish it quickly. First, identify which digestive disorder the patient came up with, whether it is decreased appetite, increased appetite, or disproportionate appetite with hemorrhoids. Identifying these things are really very important. Next, please. We'll just finish it quickly because you can read all the, and I think Dr. Sintan will share the last two slide or a slideshow or a slide PPT presentation. You will have everything in your hand to read. So I have given what to eat, what not to eat. Just go to the next slides, please. I think the participant will read themselves from the slides. This will be a guide for them to advise their patients. Next slide. Next slide, please. Next slide. Next slide, please. Okay, so in a short manner, I have given what to eat, what not to eat, changes in lifestyle. Okay, so there are no changes in lifestyle differ person to person, but just go to the list and advise your patient with proper medicine to go with these kind of diet only, because the diet makes huge difference in treating hemorrhoidal patients. I have given you the charts, what should be given and what not should be given. I think we have come to an end. I think I would like to conclude the lecture with this. I would go with questions. Anyone there, Dr. Sintan from the organizers? Shall you want to give any conclusion remark for it? Or before that, I should take some questions?
Yes, madam. First of all, on behalf of Shreyas Learning Academy, we thank you for this your detailed and clinically applied lecture. So we are very much thankful for this your valuable session. So, madam, there are some questions in chat box.
Yes, sure.
Yeah.
Definitely. Thank you. Okay. So here's one question. After Sharasutra, what medicine we have to use? So basically, the Sharasutra is usually applied for a fistula treatment. We usually maximally use what we can say for the fistula treatment. We use Sharasutra. I really like to use Trayantadi Kashaya for a Sharasutra, post Sharasutra and previous Sharasutra. It's a kalpa from Ashtanga Sangraha in Vidradhi Chikitsa. All Keralian pharmacies prepare this kalpa, but this is a very nice kalpa to use after and before Sharasutra. It will really help to reduce all the purulent discharge. So that is one of my favorite kalpa from what we can say pre and post of Sharasutra. That is Trayantadi Kashaya. Treatment of Pitta Jarsha. So usually all Pitta Jarsha are quietly close related to Rakta Jarsha. Okay, patient usually describe that Pitta Jarsha rather than itching or mucus discharge. Patient tells you that he has burning kind of pain in the anal region. Okay, so in Pitta Jarsha you have to add only what we can say Mukta. Mukta Pishti to your whatever your giving your churna preparation or anything like that. If you are giving a laxative with Eranda Haritaki or Gandharva Haritaki, please add Mukta Pishti to it. if and please go for the pitta jarsha, first assess what kind of pitta lakshana the patient have, and then select your kalpa what you are going to add. Kapha jarsha and fissure treatment. Okay, I shall just kapha jarsha is similar to that, as I have added that you have to use very sharp medicine for the kapha jarsha. If the patient is the trifada gugul, there is trifada gugul which acts very well on kapha. Kanka and gutika is also very nice. And one of the most my favorite, you use what we can say deliberately use suran in everyday food. Whether you make what we can say pulp of suran, make puris out of it or rotis out of it, make a bhaji of suran, but advise your patient to take suran in its diet because it is really helpful in kapha jarsha. And the fissure treatment, fissure treatment is most importantly, fissure treatment is given by laxative, because when you hurt the what we can say mucocutaneous junction ulcer, it will enhance all the lakshana of fissure. So you have to first choose what we can say good choice of laxative medicine for that purpose, and then local application of shatadhauta gruta is really important. You can use yashti madhu tela for what we can say yashti madhu tela for local application. You also can use yashti madhu tela in 15 ml and give it to the patient with the help of infant feeding tube. This is also a nice treatment I have experienced in many patients. Okay, is that fine? Okay, thank you for your kind words. Any other questions? I would definitely like to receive a feedback. So I would take it from your organizers.
Yes, ma'am.
Shall we conclude now? Yeah.
Yes, we will definitely convey you the feedback. So once again, on e-learning academy and all delegates, we all thank you for this valuable and clinical applied session. Thank you. Thank you very much.
Thank you. Thank you. Yeah. So I'm leaving the meeting now. Thank you. Thank you once again.
Yeah.
Yeah.
Okay.
नहीं खाएगा खाओगे क्या तो खाने का मन नहीं करते खाना तो बढ़िया पूरी है खा ले ये तो मैंने आधा छोड़ा है मुझे पता है तो खा जा रहा हूँ मोबाइल ले आज यो खा के जरा पढ़ना है मुझे मेरा टेस्ट है।
This conference will